I had a question sent to me about cystitis or inflamed bladder and blood in the urine. Now, this video is not exhaustive on all the causes of this, but this is a perspective from a nutritionist and what I would do next. And what I would do next is ask more questions. In order for me to be able to have any guidance on what's going on with a person, I want to know more about the person. Let me know more about them so that I can help support them. This is a symptom of possibly many things, and we need to know more about it. In fact, when it comes to cystitis specifically, I'm going to point out that there are many types of it. And so until we can start to know more about this person, we really don't really know which one of these things might be the cause, because we have here infectious or bacterial cystitis being number one. Now, this is the most common one. And so if my first question is going to be, is this person just coming off a round of antibiotics? Or are there other signs and symptoms that this person is susceptible to infections? Well, this is definitely going to give us an opportunity to look to fortify that person in general. There's so many times that people come in and they have many different symptoms, and this one goes away and then that one goes away, and they haven't fully fortified their body. Remember, if there is an infection that's causing the itis, which just means inflammation, and oftentimes there is probably some portion of the inflammation that is being driven by some type of what we would say maybe subclinical, meaning it's not so obvious that there is an infection, but there is something that's present there. This is always giving us an opportunity to fortify the immune system. So regardless, I fortify the immune system every 3 months, mine, and I put a focus on that in our clinic every 3 months. In fact, right now at the time of this video, it's June, and it's June Immune Month. And that means we're going to bring in all the things to help fortify the entire body so that it can get all the way down to the toes. In fact, I just got off a call with a client who's struggling with some issues on her toes, a little fungus on the toes and warts on her feet. And I said, from a nutrition standpoint, it's going to take a long time to get the nutrition all the way down there, because your body's going to use all the essential nutrients for the essential organs first. And once those are satisfied, then we'll get around to rebuilding down there. So sometimes you need topical applications for that. But back to the bladder, if that is the case, there is a couple of things that I would look at to help specifically just help remove that, because E. coli is one of those main ones. And one of my favorite things to share with people, if that's the case, if it was something to do with that, is you want to look at something that might help you in the short term, like this digestive and urinary tonic. Now, I'm not saying I would tell everybody to do this, but if you're looking for ways to help to do that, this is something you want to investigate and look into. This can be very helpful for getting rid of some infections. Now, if we're going back to these other reasons that people are having this, if the infection is there, we don't want to just kill it. We want to make sure that we are fortifying our body so that we can keep an infection from recurring, because just getting rid of the infection without fortifying your body leaves the opportunity for that to happen again. So I think of things like Congaplex as something that could help fortify, because this gives you a great source of vitamin C, vitamin A, calcium, Thymex, something that's really helpful for that. Now, back to asking more questions, I would want to know more about them. Are we talking about interstitial cystitis? Was there a radiation involved? That's a different conversation. Chemical cystitis. Now, this is one that I want to give everybody a little moment to think about, because there are toxic chemicals that are found in underwear. 10% of women's underwear in lab tests found that they were above the safe levels. So we really have to start thinking about that first layer and how do we protect ourselves from that first layer, because we have lots of evidence saying that there are toxic chemicals in there. So we have to have a different way to approach that. Now, there could be foreign body cystitis, hemorrhagic. So again, all of the questions knowing about that person, what have they been doing? What have they been eating? What else is going on in their life is going to help to start inform us as to what could be the potential that's causing this inflammation. We want to go by the most obvious first. But also, I always want to ask the question, is there any type of medication that could be involved in contributing to this? Because those are things that people are not thinking about in terms of causing other things. And when we think about the bladder being inflamed, we have to go upstream and think about the kidney as well. And there are many different ways that the kidneys could be getting damaged by medications. So NSAIDs are going to be one of those. So look to and ask that person the question, are you taking a lot of NSAIDs like ibuprofen? That could be something that could be contributing to it. So just attempting to heal the bladder or heal the infection, and you're taking something else that's causing it. We want to make sure we're asking enough questions to think about all the things that could potentially be contributing to the inflammation. And interestingly enough, this is supposed to be an anti-inflammatory, but it could be causing problems in other parts of the body. And in fact, that's what they might have been doing to get rid of the inflammation. Diuretics can be contributing to it. Blood pressures, medications like lisinopril can cause problems with the kidney. Radio contrast, we talked a little bit about the radiation earlier, but then a lot of these antibiotics, right? Did they just take a round of antibiotics? Are they taking any medications that are antivirals? All of these medications you can look up and know that a lot of those could be contributing to the problem that's causing the inflammation there. So before I can actually guide anyone where they're going, I need to know more about that person. But I would look to medications that could be contributing to it. Look for other signs of infection, because that seems to be one of the top reasons that happens. But look through that list and see, are there other things in here? And maybe there's multiples that have contributed to this. And leave me some comments with some more questions. I'd be happy to go deeper into that. But these are the questions I would start asking first to guide them on that way. And you're never going to go wrong by fortifying your immune system. There are so many things that are trying to take hold in our body. The more we can make sure we're fortified to keep them from causing inflammation anywhere, the more we can rule that piece out. And then we can start identifying some of the other things that could be contributing to it and eliminate those as well, so we can get back to healing. So if I'm back to my original analogy, if we have this inflammation, the house on fire, we have to figure out what's pouring fuel on that fire first. Is it a chemical from the underwear they're wearing? Is it an infection? Did they just do antibiotics? What is it that's creating the fire? How do we get rid of that fuel and then get back to rebuilding the individual themselves? Another question would be, is this a man or a woman? We haven't talked about kidney stones. So kidney stones could also be something that could be contributing to blood in the urine. So you're going to want to start asking questions that are going to help you understand whether or not they're kidney stones. Some of those that I ask is looking to see if there's an imbalance between calcium and phosphorus in that body. If there's not enough phosphorus to hold the calcium in solution, you can start to get calcification. Sometimes that shows up as tartar on the teeth. Sometimes it's arthritis or bursitis or cataracts in the eye. But kidney stones can also be a calcification due to a lack of phosphorus to hold the calcium in solution. So look to ruling out that kidney stone, look to ruling out an infection, look to ruling out chemical exposures, radiation, all of those. And once you ask more of these questions, then we can get a better idea is, how do we support this person moving forward once we remove the fuel from the fire? And once we are able to identify that, how do we get back to rebuild it? Thank you for the questions. And if this wasn't clear enough, please leave a comment and I'll make sure that I expound on this and get clear about this. But I want to figure out what's the next right thing for us to do in these situations. I'm never going to just want to tell somebody, oh, if it's this condition, this is what you do, because everybody's so different. And we want to use that as information about that individual. And just because we were able to handle or get the body out of an infected state in one way with, say, an antibiotic, that doesn't solve for why they were vulnerable to that infection in the first place. And that's what we want to take away is what is this teaching about us ourselves, where the weaknesses are, so that we can fortify them, make them stronger, so that we don't have that weakness in the future. Thank you for the questions. I'll continue to contribute to this series on answering your questions answered, and I will do my best to give some information on this. And if you want more, keep asking, and have a good day.